We live?
It's not doing anything. One moment.
I can see it popped up and said meeting is not streaming live.
Yeah, it's streaming.
All right, I'm going to assume that it is. Good morning, everyone. Today is Friday, February the 2nd, 2024, and this is a meeting of the Southern Maryland delegation. I'm Delegate Edith Patterson. I'd like to welcome you to our full meeting this morning. And to begin the meeting, I'm going to ask if members would honor us with a pledge, and you may see that pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. This is usually the job of Delegate Morgan, but I'm told that the governor's cabinet meeting is in St. Mary's County, and so we're very honored that they chose Southern Maryland to meet.
Our staff is in the waiting room as well.
Yeah, I see some of them coming in now.
Okay. All right. So now following the agenda, I'm going to ask if we would have the prayer from our good delegate from Calvert, Prince George's Delegate Long.
Good morning, colleagues. My prayer will be Philippians chapter 4, verse 7 and 8. And the peace of God, which passeth all understanding, shall keep your hearts and minds through Christ Jesus. Finally, brethren, whatsoever things are true, whatsoever things are honest, whatsoever things are just, whatsoever things are pure, whatsoever things are lovely, and whatsoever things are of good report, if there be any virtue, and if there be any praise, think on these things. Amen.
Amen. Thank you, Delegate Long. Let me just say this. I appreciate the delegation members who split their time between the two caucuses, because we know it's a challenge, but I recognize that and appreciate it very much. Okay. We are very honored to have Brad Fallon, who is with the governor's office, to share with us the phenomenal, ambitious priorities for the governor for 2024 session. Brad, welcome.
Thank you, Madam Chair. And it's good to be with you all this morning. Unfortunately, because I am in the legislative liaison, I didn't get to join the rest of my colleagues down in St. Mary's this morning because they're living out of Annapolis. So in Annapolis, not in Southern Maryland. But very happy to be with you all and happy to share some of the governor's priorities this year that we're putting up for consideration, in addition to other priorities that the General Assembly, of course, will be pursuing, and looking forward to working with all the members on that. We did share around a document of 16 bills that the governor himself is introducing this year. That ranges from everything from public safety to housing to fundamental economic opportunity. Instead of going through all 16 one by one, I thought I would highlight a few that we think will have a particular impact on our friends and neighbors in St. Mary's County. I think.
Brad, could I ask you, are you able to speak a little louder or closer to your mic? Does that work?
Yeah, let me see what's going on here. All right, you tell me if it's not working. I'll switch.
That's better. That's better.
We're in the State House and there's construction going on right out my window, so it may be drowned out a bit. But thanks for having me. In case we didn't hear any of that, I'm going to run through just some key components of the governor's agenda that we think will impact Southern Maryland. So I think fundamentally, the governor's agenda this year, although it really ranges on issue areas, focuses fundamentally on economic opportunity. And that's in kind of a macro scale when we look at economic competitiveness and the ability to attract employers here to Maryland, and down to the individual level when we focus on wraparound services into communities that have historically been trapped in a cycle of poverty. A top priority for the governor this year is the Enough Act, which this year seeks to put $15 million into grants into communities for communities that are the highest level of poverty by zip code in the state and have had historical levels of poverty and a lack of wealth from generation to generation, to apply for things like health services, like additional education wraparound services, and housing services and things of that nature. There is a lot of flexibility built into this program for communities to come together, work with nonprofits and private sector and apply for funding from the state to be able to ensure that we are breaking a cycle of poverty. And I'm happy to give more information on that. Another top priority for the governor this year will be housing. Statewide, we're facing a 96,000 housing unit shortage, and regardless of the impact on the individual, which is immense, which means that it's more difficult to find a home, it's more expensive to rent and purchase a home, and frankly, people are crowding into homes. We have 3 children packed into a single bedroom is commonplace. We have multi-generational homes because young families are moving back in with mom and grandma because they can't afford themselves. And frankly, we have the highest eviction filing rate in the country. And I think the governor's view is that long term, if we're going to make this Maryland's decade, if we are going to enhance economic competitiveness, we have to start with some fundamental natures to our economy. And that is our high cost of living being propped up by our housing unit shortage. So we do have some incentives this year. We are looking to bring in new investments utilizing federal dollars into low-income communities around the state through the Housing and Community Development Financing Act and creating the Maryland Community Investment Corporation. We're looking to cut through some red tape to incentivize development. Should certain ownership requirements, location, and affordability requirements be met for housing, and providing some regulatory incentives. Just as a quick note on that, there is a requirement for below market rate housing of 25% in some of these housing developments in order to receive these incentives. What that looks like is it's 60% the area median income. To take Charles County, for example, that 60% would give a limited about $75,000. A household, say, where you have 2 parents and a child, one parent is
Siri,
working.
call Elizabeth Crosby.
Calling Elizabeth Crosby, mobile.
One parent is staying at home with the child. Say you have a police officer, right? Starting salary in Charles County is $65,000. That would mean that we have public servants like teachers and police officers being able to afford to work and live in the communities that they serve. We also have some veterans and military incentives this year. I know we have some National Guard members or reserve members on the call today, or at least former, many as we do in the communities. We are looking to double the time off from 15 days to 30 days for people to serve and fulfill their obligations as reserve units. Currently, people are taking personal time off in order to fulfill their service and have their drill weekend, say, in the National Guard. Frankly, I think that's an injustice from the state. It doesn't cost us much to give them extra time off, and people should be using their earned time off to take time with their family and not just serve the country as they often do. We have a veterans bill that focuses on military families. We recognize that military spouses are moved around and sacrifice to a great extent their own careers because they may need to move every 3 years with their spouse. What this allows is for preferential hiring, both in the public and private sector, of military spouses who move from job to job and have trouble bringing in economic stability into the households. We are addressing some government transparency and some good government components here, where we are looking to streamline the processes to receive things like occupational licenses, but really building permits in the state that for far too long have held up development in key communities. We're also looking at addressing public safety. On part of that, we are working with the General Assembly. Just this week, the governor, Senate President, Speaker, and the chairs of the relevant committees announced a plan to address juvenile crime, which is at the top of many folks' mind around the state. But we're also focused on the other end, on making sure that we have apprenticeships for police officers, that we have a trained workforce, that we have a center for firearm safety and intervention when necessary, and that we do have a victims compensation fund that is adequate and quick to be able to pay out. But fundamentally, we are looking to bolster our communities and make sure that when we talk about long-term economic growth, it is spread around the state and felt on an individual level, not just on a macro scale. So I don't want to take up too much time. I was asked to keep it under 5 minutes. So I think the last bill that I will mention, and then I'm happy to take any questions or any follow-up, is that I know that there has been a lot of talk about data centers this year. We do have a bill. I know we have talked with our friends in Charles County to shout out that again, a GTS site that is looking to come in. There have been various, in my view, outdated regulatory and legal standards and law that have prevented that industry from moving forward. I think that we can do this in a smart way instead of a way that is just completely deregulated. We've seen those mistakes made in places like Virginia. but while incentivizing the industries to develop land that currently is unused, to be a revenue generator for local government, state government, and to provide good paying jobs. So we're really excited about this agenda. Thank you, Kara and Chair Patterson, for sharing around the document with everything that the governor's introducing. But with that, I'll wrap up and thank you all for letting me give my spiel this morning. And if there's any questions, I'm happy to answer.
Well, first of all, thank you very, very much, and for highlighting some of the key proposals, certainly the priorities. One, I would ask if you would just share a little bit of information, that is mental health, because that continues to be a priority concern for us in our districts.
Absolutely, and thank you for that, Madam Chair. So we do have an AOT bill this year, and for those of you who are not familiar, that is essentially services that the state can provide to ensure that somebody is receiving mental health treatment. Far too often, and I've experienced this in my personal life, and so have many of us in administration, and I'm sure many of us on the call, somebody that is unable to break a cycle or they are spiraling down because there is no way for the state or for anybody in the mental health space to truly intervene. What we are seeking to accomplish this year on a bipartisan basis, we have many co-sponsors both in the House and the Senate that will bring the spectrum here, is to require the Department of Health to, in certain circumstances, require intervention for things like mental health treatment and medication. And so we think that this will have a large impact, particularly on our homeless population around the state. But frankly, there are many families that are broken up because of mental health services being unavailable to them, or because an individual is in such a bad place that they are refusing to accept treatment. And this is a place that allows for intervention and allows for somebody to move on beyond really the worst episodes in their lives.
You're absolutely correct. Thank you so much. Senator Ellis, good morning.
Good morning, Madam Chair. Good morning, colleagues. Good morning, Brad. Good to see you. I have a point to information to share and a request to make. So as most of you know, I serve on the Finance Committee in the Senate of Maryland, and we have all the healthcare jurisdictions. And we received a briefing in the committee from our healthcare folks, Maryland Hospital Association, and others. And a very startling statistics was shared with us. In Southern Maryland, there is over a 30% vacancy in our hospitals for nurses. There are over 30% vacancy for nurses in Southern Maryland. But what's shocking is in the Eastern Shore, that's like around 4%. Southern Maryland is the worst. I mean, it's just really a super high vacancy, which affect, of course, healthcare for all our citizens. And if you look at the issue with Maryland having the worst overall as a state, having the worst emergency room wait times, and top on that, Southern Maryland have over 30% vacancy for nurses. It's a crisis for our citizens, accessing healthcare, emergency room. And you have an issue also with people going to the emergency room and leaving, and because they wait so long, I mean, between 4 and 10 hours. I mean, it's just really off the charts. And I really was not aware of that until last week. I started speaking to some of my colleagues individually about that. And I mean, are you aware of that? Are there any initiatives that the governor have to address those issues? And could you share that with me? And I know that number was new to me, so it might be new to you also, but I'd just like to hear your view on that and what we can do to work together with the Southern Maryland delegation, of course, also with the administration to really fix this imbalance.
And thank you for that question, Senator. That is a new number to me, although as health is not typically in my portfolio. So I will touch base with my colleague Jean Chung, who oversees health, and ask her to follow up with you about places where we may be able to work together. I will say that on the nursing shortage, that is something that we're dealing with statewide. And I know that the Secretary of Health and her department last year worked very closely with partners in the House and the Senate to pass reform on the Board of Licensing proposals, right? That has been a major holdup in the past, is that folks are not able to become licensed, which means that they're not able to be placed in hospitals, right? And frankly, it is people on the ground that are the victims of some of that red tape. So there was legislation passed last year to try to start expediting that process that we were very happy to see and supportive of. I know that there are ongoing efforts to address the long wait times in the ER. In the meantime, to build upon the efforts of the red tape on the licensing end, the governor did introduce the Government Transparency Act, which will in part require all of these independent occupational boards to report on an annual basis and to report to a commission looking to make cut some red tape and some expeditious processes here, how they're collecting information, how long it's taking them to process and turn around, how that information is made available, require that they put it on their websites so that people know what to expect when they enter this process and don't feel like they're getting a runaround as a disincentive to participating in the workforce in Maryland. So we are looking to make sure that as the state plays a role in directly providing that pipeline of healthcare professionals, that we are streamlining it to the maximum extent possible.
Thank you.
But I know that many of your colleagues have been working on the ER wait times. Obviously, this is a major concern of the governor, as it is all years in the state. So I will ask my colleague to reach out to you.
And if you could, thank you for that. And you mentioned the nurses, the licensing situation. So we passed legislation last year, and I worked on it really hard to make sure to give authority to the Board of Health to really work with the nursing board to fix the problems. They need IT systems. They need to be reformed. I mean, the administration needs to really double down on the reforms we pass in the legislature to really make sure the nursing board is fixed, because that is part of the problem. And also, work on that imbalance with where you have 4% nursing shortage in the Eastern Shore and 30+% in Southern Maryland. And so we gave the administration the tools to really do that. And they really need to really double down to fix that issue with the nursing situation. So I appreciate you answering that, to pass it on and to work with myself and the Finance Committee and the counterpart of the House to really fix that problem. And I really appreciate that.
All right, thank you so much. Thank you very much. Are there any other questions? If not, Brad, thank you very much for modifying your schedule to be with us this morning.
Thank you all.
Thank you, Senator, for the question. All right, Lucille, Southern Maryland National Heritage Area, what great news do you have for us this morning? Great news.
Good morning, everyone. Can you hear me okay?
Yes.
Great. Thank you, Madam Chair. And good morning to the Southern Maryland delegation. We're on two screens, and I'll be turning my computer around in just a moment to let people introduce themselves. But I wanted to give you a quick update. This is the first time we've met since we launched the Southern Maryland National Heritage Area in last May. So we wanted to make sure we thanked all of you for attending, those of you that could attend, for the wonderful proclamation, which we are still going to get framed, and to let you know that we're working really hard. Now that we've launched, as we said at the launch, this is just the beginning. We formed a steering committee, we have consultants, we're fast tracking a management plan. The National Park Service requires this step, and it's useful anyway, because we want to reach out into the community to find out how we can be the most useful and meet the needs that our community needs from this new organization. So we're holding a lot of public meetings, we're holding a lot of steering committee meetings and subcommittee meetings, and reaching out to different groups and presenting. And we wanted to come to you this morning. Usually we come on Tourism Day, and that's next Friday. So we're sort of starting Tourism Day this way because we're heritage tourism. And as you know, in Maryland, I've said this a number of times, you can't throw a stone without hitting heritage. So we work very closely with our tourism partners and also emphasizing our heritage heritage and what makes us so special. And on that note of what makes us so special, I would like to introduce a couple people or have them introduce themselves. I have members of my steering committee here. I also have partners here. So I'm going to start with Chairman Gray of the Piscataway Canoe.
Good morning there, Southern Maryland delegation there. It has been a while there since I have sat in front of you as well there. I am very honored to be here today and to have this program here, this National Heritage Area there. Once again, Maryland has become the first. I have done some research there to identify what other national heritage has an indigenous component, a pillar in their program there. And once again, we are, as Maryland, the first to have this. So I'm very honored to be a part of this program to bring the Piscataway legacy to the forefront, which is always just a part of Maryland itself there. And you can't talk about Maryland unless you talk about the Piscataway people. So it's a pleasure meeting you guys, everyone this morning, and thank you very much.
Thank you, Chairman Gray. I'm going to go around the table. You all can introduce yourselves.
Good morning, Brandon Rosario. I am the Program and Special Events Specialist at the Southern Maryland National Heritage Area.
Miss Gwen.
Hi, my name is Gwen Bankins, born and raised in St. Mary's County. I am a descendant of a direct enslaved from historic Sodley. I proudly sit on the Board of Trustees and Chair of Preservation, Restoration, and Interpretation. And I'm excited about the National Heritage Area because Maryland is just, I love Maryland, and Maryland has every component of American history here. And we have that in Southern Maryland, and we're ready to tell the story of our heritage, which is the national story.
Good morning, I'm Craig Sewell. I'm with SMADIC as Director of Programs and Infrastructure, and I will add in March, we'll have a documentary film coming out highlighting, we're calling it Grandma's Hands, and highlighting food traditions told through 6 people in Southern Maryland who share their kitchens and their recipes.
Yelling from the end of the table, so hopefully you can hear me. Nancy Easterling from Historic Sodderly. It's an honor to be on the steering committee and part of this process. This is such an important step for our entire state, and just thrilled to be a part of it.
Hi, you all know me. I'm John Hartline, Executive Director of Tri-County Council, and I serve as the treasurer for the new Southern Maryland National Heritage Area. And Lucille has gotten me greatly excited about heritage here in Southern Maryland.
Good morning. My name is Hillary Daly. I am the Tourism Program Specialist for Calvert County Government, and it is truly exciting times here in Southern Maryland.
Good morning. My name is Dorothea Holt Smith. I represent the African American Heritage Society of Charles County, and good morning to all of you. And I'm honored that Lucille asked the society to be a part of this. And in Charles County, we're doing exciting things, and especially unearthing the African American history in the county and whatnot. And I have to say, the planning department of the county and all of those people down there are helping us. And so, good morning to you again. And it's just exciting. Thank you, Lucy.
Thank you. We like to move the computer around. So thank you all. First of all, this is just these are amazing people in this room today, and we have a steering committee of almost 32 people, many who wanted to come and be here today but couldn't. One other thing we wanted to note, as we're trying to fast track this management plan, we're trying to do what normally takes 3 to 5 years. We're trying to do it in 11 months. And one of the reasons we're doing that is because it's so important now that it's 2024, we are just 10 years to the commemoration, the 400th commemoration of the founding of the state of Maryland. That's only 10 years. And you all have heard me say this before, but at Virginia, at this point, they had a lot of funding already lined up and a lot of plans already lined up. And we cannot let Virginia win. Maryland, come on, We are so grateful to Senator Bailey and Delegate Crosby, and I know Senator Ellis, you also sit on that commission, that they have founded a commission geared toward the 400th, but it will take all of our efforts, every one of us, to make sure we really, really commemorate what's special and important, and even what's hard about Maryland. So that's what we wanted to just get in front of you this morning, see if you had any questions. We continue to hold public meetings. We will invite you all. The next one will be April 20th. We're still figuring out the location. It's going to be in St. Mary's County this time. So we will let you all know, and we'd love your input. And thank you so much for the opportunity.
Well, Lucille, thank you so much. I really appreciate your enthusiasm at every level. And also, as you were introducing the members present, you made sure to include members from each county, and I appreciate that. We had heard about Grandma's hands. I'm looking forward to this because I'm told they're great recipes. And so you're a foodie like I am. I'm looking forward to that.
That's wonderful. We are supporting that video, the National Heritage Area, and we're looking to have a big launch. And we'll try to do it actually in Annapolis to make it easier for all of you all to attend if you are able. So we'll keep you up to date on that.
All right. Thank you so very much. All right. I don't see any hands, so I want to thank you for that, and we look forward to updates within the coming months. Thanks.
Thank you.
Okay. I'm honored or excited to welcome Amanda Chesney. I think during the interim, Delegate Harris, myself, and I think some county commissioners, Commissioner Patterson, was with us when we had a tour of Angels Watch in Waldorf. And at the time, there were some challenges and concerns, some positive, but also some things that we need to look at regarding this facility that serves Southern Maryland. So, Ms. Chesney, I'd like to welcome you, and you can start your presentation.
Great. Thank you. Good morning, everyone. Thank you, Delegate Patterson. I appreciate your invitation so much, and we appreciate the support around our region. And good morning, Delegate Harris and others who've come to see us at Angels Watch. I am going to share my screen so I can get you all this presentation. I am the Executive Director of Housing and Homeless Services here at Catholic Charities. And we serve at Angels Watch, Tri-County region. And so that is Charles County, Calvert County, and St. Mary's County. I'm sorry, I'm trying to get to my little thing here. Our shelter is the largest in the region, and it is unique in that it serves all three counties. A lot of shelters in our state are sort of prohibited from going outside of their region because of the funding they get. We serve all three counties, and proud to do so. We built it and we're intentional that way. So I want to tell you really briefly a little bit about what we do in Southern Maryland broadly, and then bring you into some challenges we're having keeping our Angels Watch shelter open. We do serve families and single women experiencing homelessness or fleeing domestic violence. So I will get into some of our stats and things in a little bit here. More broadly, at Catholic Charities, we provide lots of different services. One is around food, challenging food insecurity in our region. Last fall, we celebrated 40 years of our Southern Maryland Food Bank. We partner with over 45 different community food pantries in our state, and specifically in the region, to distribute free food across our region. And we've given 430,000 pounds of food each year to support families and singles experiencing food insecurity. We also have partnerships with area schools and local senior groups, and we provide what's called snack packs to make sure folks have what they need in hand. leaving school or in their homes. If they can't get to folks, get to grocery stores and such. These are the other service areas we impact in Southern Maryland. Housing services, of course, Angels Watch Shelter. We have 120 beds at that family shelter. Our St. Sebastian Townhomes is a low-income permanent supportive housing program that has 12 units and serves families, and they're paying anywhere from $600 a month to $1,000 a month for a 3-bedroom, which is unheard of in our area, but that is a long time service area for us. We also do supported employment for people with intellectual disabilities. Of course, I talked about our food services, which is a huge footprint for us. And then we address basic needs through our Parish Partners program and do some outreach in that way as well. So Angels Watch, if you've not come out to see us or visit us, please do. Happy to provide a tour for anyone who's interested. We've been serving our Tri-County region since 1989. And prior to building this beautiful new facility, which opened December 2018, we were in Hughesville. And we've grown since then. We are proud to have grown, but I think we are concerned that the need for our homeless services in the area has grown, and I can give you some of those stats so you guys have that as well. We do operate 24/7. We have a locked facility. Again, when we're serving folks fleeing domestic violence, it's really important that not only that there's no signage on the front door, so this is a homeless domestic violence shelter or any sort of shelter. We do have a locked door and 24/7 staff to make sure everybody's good and safe while they're with us. We do have 30 private individual rooms that are lockable. This is not an open air bunk bed situation. Folks are given the dignity of having their own bathroom and their own sleeping quarters within sort of a hotel-like room, so that the families can, put their kids to bed and bathe them and do all the things you do as a family who's in crisis. Having that privacy is just instrumental in getting them back on their feet. So we are really proud of that intentional design. Our rooms can accommodate up to 4 to 6 people, and we do have, most of our rooms are adjoining. So we've seen a lot of large families in Maryland that struggle to find shelter when they experience homelessness. But in this case, we can accommodate them by putting them into rooms next to each other and opening those doors. Again, it's 120 bed capacity. And something of note, and I'll get into this when I talk about the point in time count that we do annually through HUD. We keep a waiting list. When we are full, as soon as we have an opening, we pull from that wait list. We get all of our referrals from the Department of Social Services in all 3 counties. In calendar year 22, we had a 600-person wait list. And that was extraordinary. That was the largest we had. And I think it's important for you to know, as we have, the needs in our Tri-County community have increased. So I've talked a little bit about what we do and who we serve. So in 23, we've served nearly 230 people. 115 of those are minor children. 21 of them were homeless for a year or more. Many of the referrals we get are folks that have been staying in their cars, staying outside, staying in places that are not meant for human habitation, or staying in, frankly, unsafe domestic situations in order to not be on the street. We are happy to welcome those people in, and we are trying our hardest to exit people as quickly as possible to bring new people in. As you see here for our 23 stats, 25% of our folks are coming from St. Mary's, 71 from Charles County, and 4 from Calvert. We've also, because we are serving folks fleeing domestic violence, we get direct referrals from the Sheriff's Office and other law enforcement agencies. So sometimes we might get people that are outside of that Tri-County area that are looking to flee a certain region. So that's where that 3 persons come from. Our folks experience a lot of things. Like I said, 30% are coming from a domestic violence situation. As it was talked about earlier, lots of our folks are dealing with mental health crises or long-term mental health issues, disabilities, other chronic health conditions, substance abuse, all of which, so you know, from the field of homelessness, all of these things, if you're dealing with them prior to the crisis of homelessness, is just exacerbated by the crisis of homelessness. So it's our intent to end homelessness for folks as soon as possible, because these things all get worse, and the outcomes for children in school and their long-term outcomes get worse the longer they're in homelessness. So it's up to us to do as much as we can, as quickly as we can, to end homelessness for these folks. As Mr. Fallon had mentioned earlier, it's an expensive place to live. We struggle to help folks get out of their homelessness crisis. And just a snapshot for you all. You know how much a 1-bedroom costs, a 2-bedroom, if you're dealing with a family of, 5, 6 people, getting out of homelessness is quite a feat. And in some cases, even if you're working full time, it's really difficult to save up what you need to do a first month's rent and deposit to exit homelessness. So we do try to work with other funding sources and other foundations to try and get people the $3,000 to $5,000 they need just to exit homelessness, even if they have the income monthly to do so. It's often a barrier to exit because you don't have that in savings to actually leave. So I think this was all sent to you prior to this, so I'm not going to read it verbatim. One of the things that I want to draw your attention to most is our funding deficit. We are very proud of the work that we've done in the state, and specifically in Southern Maryland. We built this facility because we saw the need. And we built it on faith, which is, what you would expect Catholic Charities to do. We've had a lot of community support and a lot of donor support, but truly through COVID, a lot of that donor support has shifted. We are experiencing roughly $1 million deficit annually right now to keep the doors open at Angels Watch. This year, to close the gap, we've gotten some extra funding, and we've been so grateful for the support that we've received from Department of Housing and Community Development last fiscal year. And this year we're trying to close a $750,000 gap for the end of this fiscal year. 24/7 shelter with individual case management for these highly vulnerable families costs quite a bit of money. We do provide meals. We provide all of the necessities. Our folks are coming in with just the clothes on their back, no diapers, no clothing for the kids. And so we provide all of those things. All of that does cost money. We have a staff that's 24/7, and I would say that's probably the largest. For us, what's most challenging, very different from our other shelters across the state and in the district, we don't have the same funding sources available to us. Right now, we are very reliant on the HSP funding we receive, which is about $180,000 annually, which is the only reliable reoccurring funding we have from the state currently. We do get a Charles County Charitable Trust funding, which we have been grateful for. And we are working to try to get St. Mary's County funding as well, but that is very limited. And so again, running a shelter at $1.3 million a year, and actually we've been able to reduce it to $1 million a year by cutting some staffing and doing as much as we can to keep safety front of mind. We are really struggling. And so we've brought it to our local and state government officials to say, this is a vital resource for the most vulnerable constituents in this area, and we need support. Not only Angels Watch, but other resources like ours are in the same situation. And I'm bringing this to your attention just as a Maryland comparison. One of the things that we do annually as part of a HUD continuum of care is count the number of people experiencing homelessness. We do it the same week across the country. We just did it last week for all of our jurisdictions, and we count the number of people both outside. We try to find those folks, and we count the number of people utilizing beds, shelter beds, housing resource beds. And just for comparison, Montgomery County had counted 577 folks in FY21. And Southern Maryland, for our area, we counted 392. But if you see on the left side of the screen, that's the difference between the HUD funding we receive in those different jurisdictions. Montgomery County is getting more than double what we are getting to serve less than double the population. Similar to HSP funding, we're hoping that we can see more support. The Maryland HSP is the Homeless Solutions Program funding. Annually, that's been about $10 million since about 2019, FY 2019. Recently, there has been a reduction, a pretty strong one, from $10 million to $7 million. That is, there's also rumors of our funding being cut over the time. So we are concerned that perhaps there is not enough knowledge about the need for these resources and the instrumental role we play. We've, as a state, funded permanent supportive housing solutions, which is wonderful. We need that because of the expense burdening our particular low-income families. However, it's impossible to move someone from living in a minivan to a permanent house. You need an in-between state, and this is what emergency shelter provides. Folks need to catch their breath. They need to be safe and stable and warm and dry, and they need to work with someone while they're in crisis to get out of that state. Without funding emergency shelters, there is no bridge to that next step for folks. So we want to make sure that investment isn't forgotten. We certainly are feeling it. We are doing our best to work that out and fill that gap. But this is our challenge, and we wanted to make sure you all were aware of it. And just finally, so you understand on the PIT count, there's been a change for balance of state, which is our Southern Maryland region plus 5 other counties across the state. We counted 2,576 people in FY 2013. In FY 2020, in that same region, our Tri-County Southern Maryland and the other counties, we counted 4,018 people. So in less than 10 years, our numbers of counted homeless people have doubled nearly. So we need to pay attention to this with our wait list and the things that we're seeing on the ground. We want to make sure there's funding earmarked for emergency services that is reliable and renewable annually, so that we're not scrimping and frankly competing against our fellow providers that are trying to serve this same vulnerable population. Happy to answer any questions. I'm sure I've gone over time. Please let me know if you have any for me.
Ms. Chesley, first of all, thank you very much for providing us the handout, the information beforehand. And I just have a question. I know Senator Ellis has one. This is a quick one, because when we served on the ending homelessness, there's a question about the fairness of the point in time count. So is that a federal entity that we need to make our federal partners aware of? Or who decides on that?
Yes, it's a great question. So that's run by HUD, by the Housing Urban Development Program federally. And they provide trainings, and they have put all of our countrywide regions for distributing funding for these sources. They base it on those PIT counts, those point in time counts. I would say some of the things that our colleagues in Southern Maryland have brought up, and other rural and suburban counties have brought up as well, they simply look at the point in time count for that day and make decisions on that. We would love them to look at the number of people served annually as well as that point in time, because it's really difficult to find everybody you need in that one day. But when you're looking at annual people served, you get more of an understanding of how many people are coming in throughout the year seeking services. That number is vastly different, and we would love that to be considered as well. I think that would get to that equity piece that you're talking about a little bit better. because it gives you the full scope.
Great. So
so
what
yeah.
we'll do is, if you would give us talking points or a draft, we will send to the congressional delegation
Sure
to
thing.
forward on to HUD.
Sure
And
thing.
Senator Ellis, you have a question.
Yeah, thank you, Madam Chair, and thank you, Ms. Chesney, for your presentation. Over the years, even before the new Angels Watch Shelter was there, I mean, my wife and I have always kind of like supplied excess produce from our garden from time to time. And so we're quite familiar with the great work that you do. And even though I wasn't able to visit last year, I was there the year before. And so, you know, I'm always there to be supportive. I'm just thinking I really don't understand the structure. So my question is, as far as you know, it's Angels Watch is part of Catholic Charities. And when I hear Catholic, I think about the church. And I don't think you shared if you receive any money from like the Archdiocese of Washington or any other church affiliated institutions. So could you share that with us, please, as far as
Sure.
if you have any funding from
Sure.
the Archdiocese or any of our other Catholic
Sure.
church institutions?
Yes, we do. It's typically less than 1% of our budget. That is not overall as an agency, 1% of our budget. In recent years, it's been about $1 million across the board. We have 54 different programs across our region. So we serve Montgomery County, Prince George's County, our 3 Maryland Southern counties, and the District of Columbia. So that $1 million is spread across all 54 programs. And that's the extent of what we get from the Archdiocese of Washington. Now, when you're talking little c church, we get a lot of donations from folks that are affiliated with all sorts of denominations and non-church going folks. But that's really what we rely on to close gaps.
Yeah, is there a discussion for the Archdiocese to, you know, up their contribution? Because I mean, this is like a great organization, Catholic Charities. You do great work, and it creates a really good image for the church. And so, and I don't see many other churches doing that. So I'm just curious. I'm not a Catholic, so that's why I'm asking these questions. I'm aware of, you know, the mission of the church and how you're tied into the church organism.
Yeah, well, so the Archdiocese, as I understand it, provides funding for a multitude of things in the Archdiocese, including church-run programs and other social programs that they're doing. We're one of many things that they fund. But again, like church small c is generally our group of donors, frankly. But yes, we are asking everyone and anyone to help us fill the gap. But that is definitely on the table. We have recently begun or restarted our Southern Maryland Task Force, which was on hold during COVID. But we have gathered a lot of influential and prominent and very passionate people in Southern Maryland to help us get a different groundswell going to help support us as well. So we have received some really great feedback from that, but $1 million gap annually is a huge lift for a donor base, especially if it's just from one particular reason. So more than that, I'm hoping that our region and our government officials will see this as an emergency service to fund rather than an extra, because if we went away, that's a whole lot of emergency crisis on our hands, and it will be picked up by the police, by the EMS, by all other institutions. So we're making sure that that doesn't happen. But if we can't keep our doors open, we can't stop that flood.
Thank you, Ms. Chesney. I think what we'll do is look at multiple, and that's a valid question from Senator Ellis, because I believe we'd ask that when we're visiting your center as well. Senator Jackson has a question. Senator Jackson, you're on.
I have a comment. Thank you for the presentation. I am one of the few Catholic boys on the call. We work extensively with Catholic Charities. We're doing some work over in on the Calvert County side, as well as in Prince George's, on the side where I live. And so we will certainly add this to our list to encourage and kind of nudge the diocese to, you know, to find ways to expand their resources that they send out. Oftentimes, as with every other organization, oftentimes, there's a set amount that goes out, and we'll talk to them about adjusting that. So we'll be in touch, Ms. Chatterjee.
Okay. Okay, thank you.
Ms. Chadley, thank you very much for
Of course.
for the presentation, and we will stay in touch.
Okay, thank you very much.
Thank you for the
Appreciate you
questions.
all.
And right now, John, you're on, and members delegation, you've had a chance to review the letter that was draft to be sent to Secretary Wiedefeld from Tri-County. And John, you want to just get a quick overview? And I know that this is from Tri-County, so it was my understanding the delegation would also send a letter to the secretary to regarding the budget. So John?
Yeah,
Okay.
yes. We will send a letter from us to the secretary. We are going to copy in a number of people, which George Clark said would be the appropriate people to inform of our letter. And we've sent a copy of that letter up to you as a model, and I would encourage you to use the same copy in people, so the right people get the information that we're providing.
All right, thank you so much. And Senator Jackson, Senator Ellis, I know that we will rely on you for talking points as well, since this budget issue comes before you largely before us.
Absolutely, as well as Senator Bailey. So yeah, all three senators will be involved. So
all right, thank you
on that side as well. Thank you.
I appreciate that. All right, we're winding down, and you have a list of upcoming meetings, events. A reminder, February 13th, there is a dinner for Southern Maryland. It's at Aqua A12. It's at 6:30 on the 13th. And our next official meeting is February the 16th. And then there are other kinds of activities planned as well, including the Maryland Mayors Association on the 29th, which is MML. Our reception on the there are two things. February 29th is Southern Maryland Delegation Reception. And there are last three meetings in March 1st, 15th, and 29th. Okay, anything good for the caucus? If not, have a great weekend, and Charles County Delegation, I'll see you in a minute. Thank you for attending. Thank you, Kara. Goodbye.
Thank you. Have a good week.